Hello, my name is Jamie Gillespie. I am your Clinical Informatics Manager. I am here with our healthcare leaders to talk about optimizing the use of data to inform healthcare decision making. On the agenda is an introduction, purpose of data capture, literature review on how data is processed, my recommendations on optimizing our health information system to improve patient outcomes. Overcrowding is a major problem in our emergency department. It causes increased wait times, strains our resources, overburdens staff, delays patient treatment, prolongs disposition, and compromises quality of care. While our current EHR does keep track of wait times and our left without being seen numbers, it is imperative that we use this data to make healthcare decisions so we can improve these outcomes and measures. Typically, when a patient arrives to the emergency department, they are seen by the nurse, given a priority score, and then they can wait several hours to see a doctor. Once they see a doctor, the doctor puts in orders, usually labs, blood work, urine, radiology, imaging, and then the patient waits again for results, and then a treatment plan can be made. There is a lot of evidence that utilizing triage nurse orders in triage can expedite care, decrease wait times, and left without being seen numbers. On average, about 37 minutes per patient can be saved. And there is evidence to show that accuracy of triage nursing orders is comparable to provider medical doctor orders. The purpose or ultimate goal is to expedite our patient's plan of care and get them to position faster, which results in less crowding. The faster we can get our patients to disposition means shorter wait times, less patients are leaving without being seen, and better health outcomes are going to ensue. Data capture from our electronic health record is imperative to be used to inform our healthcare decision making in our workflows and policies. Data can be extracted from our electronic health record or EHR to provide insight on the challenges of our patient flows. Data mining is a process of using software to discover relationships and predictive information. It includes 4 steps. Number 1, problem identification. Obviously, our increased wait times left without being seen is having a detrimental effect on our patient outcomes and satisfaction. Second, we explore data. 3, pattern discovery. And 4, knowledge deployment or dissemination, spreading this knowledge and making informed decisions. Just as we utilize evidence-based practice, we need to make sure we're using data-based practice when making our decisions as well. Data mining can also result in visual graphs and visual aids, roadmaps, and workflow to aid in our decision tree and decision-making processes. The metrics that we want to measure and extract are our door-to-doctor times, length of stay, our left without being seen, and the morbidity and mortality numbers. Looking at the literature on how data is captured, processed, and analyzed and visualized to better inform healthcare decisions, there is a lot of literature out there, including quite a few meta-analyses and systematic reviews. Major themes that I have found is that clinical decision-making, to define it, is the use of data collected by interoperable clinical information systems to assist in decision-making. We can utilize healthcare information systems to track our patient flow, healthcare outcomes, patient satisfaction, and hospital revenue. Big data, it needs to be not only accessed, sorted, analyzed, and implemented, and also cleansed, because there can be quite a bit of missing data or invalid data as well. We want to make sure that what we are mining is pertinent to our problems. Nursing leaders and healthcare medical leaders should use data science to inform our decision making and to improve our healthcare outcomes. Clinical support systems use healthcare information to support decision-making and improve quality of care. I specifically wanted to share this decision-making roadmap with you. This is the CRISP-DM roadmap by Prunelli et al. In 2020. This is a great roadmap, a visual aid for our leadership to increase not only our leadership skills, but utilizing data science and principles to inform our decision making. This roadmap is proven to guide healthcare leaders to better understand the techniques, engage the appropriate stakeholders, create the necessary collaborations to make our healthcare decisions. Starting at the top, number 1 is understanding the research question. We must make sure that our question is described enough in detail so we can determine our specific input and output data to answer our research question and our specific goals in mind. Next is exploring data analysis. There's lots of software involved available to explore, summarize, and visualize the data. Data preparation, we just talked about cleaning, processing, and analyze the data, having knowledge on how to handle the missing or invalid data. Modeling and analytics, are using verified software to perform the analytics to form objective rules and validating the data. Evaluation is the metrics used for evaluation for precision, accuracy, and recall. And lastly, deployment or dissemination of the data and making it make sense so we can make good informed healthcare decisions to make the best patient outcomes we can. As your clinical informatics manager, my specific recommendations to our healthcare leaders to optimize our healthcare information system to improve decision making. I like to use PDSA, Plan, Do, Study, Act. First step is we identify the problems and define metrics. Extract, clean, and analyze the data from the EHR. We identify that our problems are incredibly long wait times, our door-to disposition times are increasingly lengthening, patient satisfaction is going down, love without being seen is going up. These are all metrics that we can extract and use that to make better decisions. I would like to experiment with utilizing triage nurse orders on a small scale to start and see how it goes. With study, I want to measure and data mine all the metrics we talked about. I want to see if utilizing the triage nurse orders, does it improve our left without being stay? Does it expedite care? What is our total length of stay? Is our satisfaction going up? All these are going to be extracted and measured. And lastly, once we have all our data, we will make a decision as a team. We can modify the plan, continue it, or discontinue it based on the data. And then we can disseminate it to all of our hospitals if it seems to be improving outcomes. So to sum it all up, overcrowding in our emergency department presents a major problem within our healthcare delivery. Data from our EHR is not currently being utilized to inform decision-making and improving patient flow. There is a lot of evidence that implementing triage nurse orders can improve throughput and enhance patient outcomes. Nurse informaticists should use data mining to assist in the best decision-making. And I would like to take this time for anybody to ask questions. Thank you for participating with me today. I look forward to our plans for the future and how we can use data to make better healthcare decisions and improve our quality of care.